Hello, this is Miss Nicole Sheridan from Georgia Northwestern Technical College, Floyd County campus, and I'm going to be doing your lecture today on Chapter 3, Human Reproduction and Fetal Development. So we're going to discuss the female reproductive system. This is a review of your A&P, and it's important that you're familiar with these structures and the functions that make childbearing possible. So we're going to talk about the external organs first. First, we have the mons pubis. It's a little pad of fat that lies over the symphysis pubis. After puberty, it becomes covered with hair. You have the labia majora, as seen in the picture right here. Those are two larger folds of tissue that extends from the mons pubis to either side of the vulva. The labia minora are two smaller folds of tissue that form a hood-like structure. So you can see that here in this picture. They surround the clitoris. They have sweat and sebaceous glands to help lubricate. You have your clitoris. That's a small sensitive organ containing erectile tissue. It's right in front of the vulva and below the mons pubis. So that's right here. You have the vestibule of the vagina. That's an area between the labia minora and where the urethra and the vagina open. You have your Bartholin glands. They're located on either side of the vagina under the labia majora. Their ducts open to secrete lubricating fluid, so it helps moisten the vulva, facilitate sexual intercourse. The perineum is the skin from the vaginal opening to the anus. It lies over the muscles and fibrous tissue that separate the vagina and the rectum. Female reproductive system internal organs. You have your ovaries. Those are two small glands located on either side of the uterus, slightly behind and below the fallopian tubes. Your ovaries store approximately 1/2 million eggs. The ovaries secrete the hormones estrogen and progesterone during each reproductive cycle, which we'll discuss a little later in the slideshow. Your fallopian tubes are attached to the uterus at one end, and the opposite end, they curve over the ovaries with very fringe-like ends. The function of the fallopian tubes is to provide a channel for the sperm to travel, and it helps transport the egg into the uterus. Your uterus is a muscular triangular shaped organ located between the rectum and the bladder. The uterus function is to provide the environment for the growth of the fetus. The uterus is like the house for the fetus. The top portion of the uterus is called the fundus. The lower portion of the uterus that projects into the vagina is your cervix. Like when the doctor does cervical checks when you go to the doctor when you're pregnant. Your cervix has cervical mucus, and that helps to act as a bacteriostatic agent, lubricates the vaginal canal, provide an alkaline environment, so it helps protect the sperm from acidic vaginal secretions. Your uterus contains different layers. You have your endometrium, that's your inner mucous membrane layer. During menstruation and after delivery, the cells of the endometrium are sloughed off. You have your myometrium. This is a thick muscular middle layer. The myometrium is arranged in a network, so it's able to thin out, pull up, and open the cervix so that the fetus can be pushed out of the uterus. And then you have your epimetrium. This is the upper outer layer that envelopes the uterus. Your uterus is supported by several different ligaments. Those ligaments help support and stabilize the reproductive organs. First one is your broad ligament, and it helps keep the uterus centrally placed, provides stability. You have the round ligaments. They're situated between the broad ligament, anterior and inferior to the fallopian tubes. You can have some ligament pain during pregnancy, especially when the fetus is really starting to grow and expand. You can have some ligament pain. You have the cardinal ligaments that arise superior and lateral from the uterus and inferiorly from the vagina to provide primary support for the uterus. The uterosacral ligaments attach to the uterus to the sacrum. The vaginal tissue is composed of smooth muscle, elastic connective tissue, and it's lined with stratified squamous epithelium. So it's very similar to skin. It lies behind the bladder and urethra and in front of the rectum. The vagina begins at the vulva and ends at the cervix, and its two main functions are for sexual intercourse and childbirth. The female pelvis resembles a basin or a bowl with two sides consisting of the hip bones and its back consisting of the sacrum and the coccyx. The pelvis helps support and protect the pelvic contents. It helps support and distributes body weight. It forms the birth passageway. The female pelvis is shorter, wider, and more circular than the male pelvis. So this allows the female pelvis to be the right shape for childbearing. The ischial spines are the narrowest diameter the fetus must pass through during childbirth. The breasts are two glands that secrete milk. In the center of the surface is the nipple. The nipple is pink until pregnancy, and then it will become darker. Inside the breasts are ducts that lead to the nipple. The tissue of the gland is similar to a sebaceous gland, but it's more highly developed to produce milk. It's separated into lobes by fibrous tissue, and then the lobes are subdivided down into lobules. The breasts develop during puberty, and the further development will occur during pregnancy. And that's due to all the hormones that happen during pregnancy. You have colostrum, that's a fluid rich with antibodies that can be secreted in small amounts during pregnancy and prior to milk production. Milk production begins 2 to 3 days after childbirth. Now we're going to discuss the female reproductive cycle, your menstrual cycle, and it contains 2 phases. Your first phase is called the follicular phase. The follicular phase starts on the first day of menstruation and ends with ovulation. So during this phase is when a select number of follicles in the ovary start to mature until one dominant mature follicle releases an egg. So your ovary is made up of follicles. They're very tiny, fluid-filled sacs, and all of those fluid-filled sacs contain an immature egg. During the first couple weeks of your menstrual cycle, hormones regulated by the hypothalamus are released by the pituitary gland, and they trigger a few of these follicles to grow and mature, and that makes the egg inside the follicles to mature as well. So eventually there's going to become one follicle in your ovary that becomes the dominant follicle. So that dominant follicle, the most mature one, is where the egg that will be released at ovulation comes from. The hormone follicle stimulating hormone causes several of those follicles to grow, but remember, there's going to be one dominant follicle, one mature follicle to release the egg during ovulation. All the other follicles will die off. Your mature egg follicle is going to secrete estrogen. So estrogen thickens the endometrium. It helps make that lining of the uterus a good home for the egg to implant. It wants to make a nice, friendly, welcoming home for that egg. Elevated estrogen levels cause the follicle-stimulating hormone to stop, and then you have your luteinizing hormone, or LH, released. And that's really where the follicular phase ends, because it ends with ovulation, the release of that egg. So one thing to remember about your follicular phase is that it begins on the first day of your menstruation, and it's about all those follicles in your ovary becoming mature. And then one dominant follicle will release an egg during ovulation. The second phase of the female reproductive cycle is called the luteal phase. It begins on the day the mature egg is released, called ovulation. It lasts approximately 14 days or so, unless the egg is fertilized. And it'll end just before the menstrual period, assuming that no fertilization has occurred. So this is called a post-ovulation phase. So it's post-ovulation, and the body is starting to prepare the womb to accept a fertilized egg, also called an embryo. So during ovulation, that mature egg bursts from the follicle, and it leaves behind kind of an empty shell of cells. And that empty shell of cells go through a transformation after ovulation. It kind of collapses back onto itself and starts to change and transform based on all the hormones that are secreted. The collapsed follicle is what becomes the corpus luteum. You have your luteinizing hormone, so that converts that ruptured follicle into what's called the corpus luteum. The corpus luteum is actually a temporary gland structure. It secretes the hormones estrogen and progesterone, and it prepares the body for the possibility of conception. So estrogen and progesterone are those hormones that are helping to further build up the lining of the uterus. It helps form a nice bed or a home for the egg to implant itself into, and it also helps maintain that lining. Now, if the egg is not fertilized, the corpus luteum will degenerate, and you will see the levels of progesterone and estrogen drop. So the corpus luteum will break down if the egg is not fertilized. So that causes a drop in progesterone and estrogen, and this in turn is what triggers menstruation, our menstrual period. The reproductive cycle will start all over again in this case. Well, what happens to the corpus luteum if you do get pregnant, if the egg is fertilized? So if you do get pregnant and the embryo or the fertilized egg implants itself into the uterine lining. So that embryo implants itself into that uterine lining, which remember that the estrogen and progesterone made a nice bed for it to implant itself. It wanted it to be very homey. So it implants itself in the uterine lining, and then a very early placenta is formed by the embryo. This early placenta releases the pregnancy hormone called HCG. That's the hormone that pregnancy tests will detect. And we'll talk about that. That's in the slideshow as well. That HCG pregnancy hormone signals the corpus luteum to continue to secrete progesterone. So those progesterone hormone prevents the endometrium from being expelled, and it continues to prevent further ovulation. This is a good little drawing of the menstrual cycle of the follicular and luteal phase, and a YouTube video that you can watch if you like. The PowerPoint will be posted on Blackboard for you, so you can find this link. I'll also have a menstrual cycle handout on Blackboard for you as well. The male reproductive system consists of the scrotum, penis, and testicles in which the sperm are produced. External organs include the scrotum, which is made of 2 sacs separated by a septum. Within each sac are the testicle, the epididymis, and the beginning of the spermatic cord. The penis contains cavernous tissue. This tissue has spaces, and those spaces will fill with blood, causing the penis to become erect. The arteries that supply the blood to this region become dilated and filled with blood, so that'll produce the erection. Semen is expelled or ejaculated through the end of the penis when a male reaches climax. Internal organs include the testicles that are located in the scrotum. These are the reproductive glands of the male. Each testicle consists of 200 to 300 lobules, and the lining of these tubular walls contains cells that develop into spermatozoa. The tubules are supported by loose connective tissue. This connective tissue contains groups of interstitial cells which secrete the hormone testosterone. Testosterone helps promote the development of male reproductive organs and the secondary male characteristics like hair growth and deeper voice that occurs during puberty. The epididymis is a tightly coiled tube attached to the back of the testes. It transports sperm and brings the sperm to maturity, as they are immature when they leave the testes. Your sperm gain motility in the epididymis and have the ability to move after about 18 to 24 hours or so. During sexual arousal, contractions force the mature sperm in the vas deferens. The sperm are stored there until ejaculation occurs. You have your prostate gland that provides additional fluid to help support the sperm. Your vas deferens transports the mature sperm into the urethra. The seminal vesicles create a sugar-rich fluid that provides energy to the sperm. The ejaculatory ducts empty into the urethra. The urethra is a tube that carries the urine out of the body, and it also functions as carrying sperm when the male reaches climax. The entire male reproductive system is dependent on hormones, which are chemicals that stimulate or regulate the activity of cells or organs. The primary hormones involved in the functioning of the male reproductive system are the follicle-stimulating hormone, FSH, luteinizing hormone, LH, and testosterone. FSH and LH are produced by the pituitary gland located at the base of the brain. Your follicle-stimulating hormone, or FSH, is necessary for sperm production, which is called spermatogenesis. And LH, luteinizing hormone, stimulates the production of testosterone, which is necessary to continue the process of spermatogenesis, or sperm production and maturity. Testosterone also is important in the development of your male sex characteristics, which include muscle mass and strength, fat distribution, bone mass, sex drive, that deeper voice, hair growth, and things like that. Fertilization. The male sperm and the female egg, called the gametes, meet in the fallopian tubes. The fallopian tubes are where fertilization occurs. Of 14 million deposited into the vagina, only 1 to 10 sperm reach the fallopian tube approximately. 1 sperm will penetrate the outer layer of the ovum, and then fertilization will occur. Each gamete brings 1 set of 23 single chromosomes, and when fused, the total of 46 chromosomes produces a cell, which is called the zygote. The sex of the embryo is determined at fertilization. The female brings 2 sex chromosomes, XX. So for female, we got XX chromosomes. Your male contributes 2 chromosomes, X, Y. At the moment of fertilization, if the zygote has an X chromosome from the mother and an X chromosome from the father, it will be a girl, XX, female. If the zygote has an X chromosome from the mother and a Y chromosome from the father, it will be a boy, XY. If fertilization occurs, the lining of the uterus does not begin to degenerate. Instead, it produces a place for that zygote to implant. Estrogen and progesterone levels remain high, and 1 additional hormone, your pregnancy hormone, called the human chorionic gonadotropin, HCG. This is produced to support the development of that embryo. So that hormone's produced by the fertilized egg. Your fertilized egg secretes that HCG, that pregnancy hormone. Elevated levels of HCG can be first detected by a blood test about 11 days after conception or so, and then urine tests about 12 to 14 days after conception. The zygote divides via mitosis and grows to produce an embryo, which is the stage of development between the fertilized ovum and the fetus. And I'm not so concerned with you remembering all of this blastocyst stage and all this. Main thing is just know what the embryo is. It's kind of that stage of development where it's in between that fertilized egg and the fetus. And of course, the placenta is very important. Develops at the site of implantation. And the placenta is an organ that sustains the fetus during intrauterine life, or the gestation period. Next, we have our process of fetal circulation, which I'm going to discuss more in detail on the next slide. Fetal circulation. So in order to understand fetal circulation, the main thing is to recap how adult circulation works and the role that the lungs play. So it all starts as you breathe in and oxygen enters your lungs. This oxygen fuels your blood, which then travels to your heart. It enters through the left atrium of your heart, and from there it travels into the left ventricle. This oxygenated blood is then pumped into the aorta and the arteries, which sends it to the upper and lower parts of the body. The aorta is the highway of the exchange and sends the blood through regional roads or arteries and alleys, which you could call capillaries, and it helps pass the oxygen into the tissues. Once the blood gives out all of its oxygen, it collects in the veins, and then it will travel back to the right atrium and off to the right ventricle. From there on, it travels back up to the lungs to get more oxygen. But that's not how a fetus gets its oxygen, however. Fetal lungs are closed off during pregnancy because they're filled with amniotic fluid. Yet the fetus still needs oxygen. This is why there is a detour in place. The mother's oxygenated blood goes to the placenta, and the placenta filters out any blood gases such as oxygen to the fetus. The blood itself does not cross over into the fetal circulatory system through this process, so only the oxygen gets passed through. But this still doesn't explain how the blood can travel without going to the lungs itself. After all, circulatory system of the fetus must be wired in such a way that the transition from a fetus to a baby is seamless. The baby's going to need oxygen immediately, and there's no room for error. So a completely different system that does not include the lungs is not an option. Well, Mother Nature has that solved. The blood from the umbilical cord connects with the veins of the fetus. So blood arrives in the umbilical vein, and then you have a little detour called the ductus venosus that helps shunt the oxygenated blood from the placenta away from the semi-functional liver and toward the heart. So the ductus venosus helps shunt the oxygenated blood directly to the heart. There's then a small oval window or hole called the foramen ovale, open between the right and left atria. The blood skips the trip to the lungs and goes straight through the opening into the left atrium, through the left ventricle, and continues to circulate throughout the circulatory system. The blood goes to the tissues and gives oxygen to its cells, and then back through the vein system towards the heart. At the same time, the blood flow separates and flows back through the umbilical cord towards the placenta. However, there's a second flow of blood, the deoxygenated blood that's returning from the upper part of the body of the fetus to the right atrium must also skip the journey towards the lungs. So luckily, there's another security patch to address that. It's a shortcut called the ductus arteriosus that connects the aorta with the pulmonary artery, so it avoids the lungs and completes a full cycle of the fetal circulatory system. So the main thing to remember for your testing purposes is just these three little detours here: ductus venosus, foramen ovale, and ductus arteriosus. Those are the main things to recall. So as the baby is born, their chest and lungs expand, and the amniotic fluid is partially absorbed. Then within a couple of days, both the oval window, that foramen ovale, and the shortcut access route will close, and it's going to let the baby's lungs do all the work. Fetal growth and development in the first trimester is a critical time. It's where rapid changes are occurring and development of major organs and structures are being produced. I'm not so worried about you remembering these three germ layers. What is important is this right here. All internal organs are produced. They're still going to continue to develop, but all internal organs are produced, and heart development is complete by week 8. By week 8, the embryo has a human-like appearance. So if you would go to page 30 in your maternity textbook, table 3.1, highlight week 8 in table 3.1. Those bullet points are important. All internal organs are produced, heart development is complete, and the embryo has a human-like appearance. Another one to take note to is month 3 on table 3.1. This is when the sex of the fetus can be determined by examining those external organs, and bone tissue starts replacing the cartilage. Second trimester, as far as fetal growth, your organs and structures are developing. Month 4, your skeleton is established. The appearance of scalp hair and lanugo begins. Lanugo is the very fine, soft, baby-like hair. By month 5, your internal organs continue to develop. Your fetus can react to loud noises and music, things like that. Brown fat and vernix begin to form. Brown fat is the dark-colored adipose tissue that has many blood vessels. It's involved in rapid production of heat. And vernix is white, creamy, naturally occurring biofilm on the fetus. Your fetus is actively sucking and swallowing in amniotic fluid in month 5. And by practicing that suck and swallow, it is practicing breathing. It is working those muscles to help with breathing. By month 6, respiratory movements occur and alveoli appear in the lungs. By the 3rd trimester, it's time for the fetus to gain weight and to mature, prepare for life outside of the uterus. By month 7, the body fat increases. They can use the sense of vision and hearing. By month 8, they have active periods that are more noticeable by the mother. So they become much more active. Month 9, the fetus matures and becomes prepared for birth. The fetus has a smooth pink skin with that vernix, that biofilm present in the skin folds. Lanugo present on the fetus shoulders and upper back. I am not concerned with you remembering these 3 germ layers that develop, but I just wanted to provide you with this visual here. Now we're going to discuss the accessory structures of pregnancy that will be of importance. The first one is the placenta. This provides the fetus with oxygen and nourishment. The placenta is an organ that develops in the uterus during pregnancy, and it provides oxygen and nutrients to the growing baby, helps remove waste products from the baby's blood. The placenta attaches to the wall of the uterus, and then the baby's umbilical cord arises from it. The organ is usually attached to the top, side, front, or back of the uterus. As the cells that will be the placenta grow deep into the uterine wall, and they connect indirectly with the mother's blood vessels. At the same time, the fetal circulatory system is also developing. In the fetal blood vessels form the placental villi. The umbilical cord attaches the fetus to the placenta. As the placenta continues to grow, villi are formed, which are finger-like projections that are surrounded by the mother's blood. Blood flows around the villi and transfers to the fetal blood supply occur. Gas, nutrient exchange, antibodies, and waste removal take place across the villi walls in the placenta. The walls also keep the fetus blood from mixing with the mother's blood. The placenta provides for all fetal oxygenation and nutritional needs while in the uterus. The placenta also acts as an endocrine organ by producing hormones. So the other main function of the placenta is acting as an endocrine gland, which is a gland that secretes hormones directly into the blood, acting as a regulator for the body. The placenta secretes many different hormones into the bloodstream to support the pregnancy and the fetal growth. The 4 main hormones produced by the placenta are called the human chorionic gonadotropin, HCG, your placental lactogen, estrogen, and progesterone. So they all play a different role and have a specific function during the pregnancy. Progesterone supports the endometrium by supporting the developing embryo. The endometrium is that lining of the uterus, and progesterone helps prep it into a nice, welcoming home for that fertilized egg to implant. Progesterone helps calm and quiet the uterine muscle to allow for successful implementation. Estrogen, this stimulates the growth of the myometrium, helps improve blood flow to the placenta and the fetus. Estrogen also stimulates breast development to help prepare for breastfeeding. We have our human chorionic gonadotropin, HCG, our pregnancy hormone. So this stimulates that corpus luteum to produce estrogen and progesterone during the first 10 weeks after conception. And you can test for HCG to determine pregnancy either by urine or blood test. Then we have our human placental lactogen that assists with milk preparation. It increases the mother's metabolism during pregnancy. And relaxin, it works with progesterone to help maintain the pregnancy. It also causes relaxation of those pelvic ligaments to help stretch and aid in the birthing process. After delivery of the baby, the placenta is delivered. It's often referred to as the afterbirth. The umbilical cord is clamped and cut, and the site of the attachment on the baby is commonly known as the umbilicus, the navel, or the belly button. So here's a picture of the placenta, and we spoke about the placenta providing the fetus with oxygen and nourishment. And it does this through the umbilical cord. And I want you to take note of this umbilical cord here. This is formed by the 5th week of gestation. And your umbilical cord joins the fetus to the placenta. I want you to remember that the umbilical cord has 2 umbilical arteries, and it has 1 umbilical vein. The umbilical vein carries oxygenated blood to the fetus. So it carries oxygenated blood to the baby, and then your 2 umbilical arteries carry deoxygenated blood away from the placenta. So I always remember arteries carry deoxygenated blood away. I just think of that A in the word artery and then away. And if it's going away from the placenta, you know it's deoxygenated blood. If it's going to the baby, it's providing the baby with that oxygen and that nourishment. So here's an illustration about how babies breathe in the womb. We have the mother's placenta that supplies blood with oxygen to the baby. And we have the umbilical cord, which we spoke about on the previous slide, that delivers oxygenated blood to the baby. So babies don't breathe in the womb as we understand breathing. Instead, babies rely on their mother's breathing to receive oxygen to their developing organs. After 9 months of growing inside a mother's body, a baby undergoes a complicated physical transition as they exit the womb. Research shows that this transition is one of the most intricate things our body will ever do. While babies practice breathing in utero, their lungs aren't used for breathing until they actually take their first breath outside the womb once they're born. The placenta and the umbilical cord are organs that enable a developing baby to get everything it needs from its mother. That's including oxygen. Every breath the mother takes brings oxygen into her bloodstream. The placenta carries oxygen to the placenta and then to the umbilical cord to the baby. During weeks 10 and 11 of pregnancy, the developing fetus will start to inhale tiny bits of amniotic fluid. This inhalation is more like a swallowing movement. So it's swallowing bits of amniotic fluid. This helps the baby's lungs as they begin to develop. It's actually practicing breathing. Especially by the 32nd week of pregnancy, the baby will begin to practice breathing like movements, less like swallowing and more like compression and expanding the lungs. Even though the baby's lungs aren't fully developed at 32 weeks, there's a good chance a baby born at this stage could survive outside the womb. The breathing practice is a developmental milestone that sets the new baby up for success during their first cry. The baby's lungs are considered mature at 36 weeks. By then, the baby has had at least 4 weeks of breathing practice. We previously spoke about the hormones the placenta produces, so just review these bullet points here. We spoke about the umbilical cord earlier when I showed you that picture. We talked about how the umbilical cord joins the fetus to the placenta, and it's composed of 2 arteries and 1 vein. The umbilical vein supplies the fetus with oxygenated, nutrient-rich blood from the placenta. Conversely, the fetal heart pumps unoxygenated, nutrient-depleted blood through the umbilical arteries away from that fetus back to the placenta. Remember, arteries away. They move unoxygenated blood away from the baby back to the placenta. The amniotic membrane is a thin membrane formed from the ectoderm layer that contains the amniotic fluid, which is commonly known as the bag of water. The functions of amniotic fluid are that it cushions the fetus, it provides buoyancy, allowing movement and growth of the fetus, it prevents amniotic membrane from adhering to the fetus, prevents the umbilical cord from compressing, it protects the fetus from bacteria from the vagina, and it provides fluid for the analysis of fetal health and maturity. The average amount of amniotic fluid is 700 to 800 milliliters. So any variations in the amount of amniotic fluid can indicate potential health problems for the fetus. If you have low amniotic fluid levels, this could lead to the cord becoming compressed, decreased fetal movement, and asymmetrical growth of the fetus. A multiple pregnancy means that the woman has 2 or more embryos in her uterus. These embryos can come from the same egg or different eggs. If the babies are born from the same egg, they're termed identical. Babies born from 2 or more eggs are termed fraternal. Monozygotic twins form when a single fertilized egg splits. So it splits into 2, and that split occurs, and the embryo will have its own amniotic sac. So each has its own separate amniotic sac, but with monozygotic twins, they will share a placenta. The monozygotic twins both implant in the uterus, and they develop as 2 babies, and they will always be the same sex. Your dizygotic twins are more of a rare instance. When two eggs are fertilized by two separate sperm, this could even be caused by different fathers. So this is when the egg is fertilized by sperm from different men, leading them to have different biological fathers. So it makes the twins half siblings. This is extremely rare. One way that this could occur is if a woman has sexual intercourse with two different men within that same time frame that both embryos are conceived. You know, we might assume all instances of twins with different fathers are the result of mother having sexual intercourse with different partners, but it's not the only scenario in which that could happen. That situation can also happen when twins are the result of fertility treatments. For example, in a mix-up at the lab, equipment had been used twice, causing another man's sperm to be mixed with that of the intended father. And this actually has happened before. I was reading an article about it, and it happened through in vitro fertilization with different fathers. So dizygotic, it's very rare instance, but it can be from different fathers. A woman is more likely to have multiple pregnancies if she's older than 35, of African American descent, if you have a family history of twins, if you've undergone fertility treatments, or they've had a history of previous multiple births. The effects of teratogens on fetal development. So medications and substances can be very harmful to the developing fetus. The general rule of thumb is to use as little medication as possible during pregnancy to keep the developing fetus safe and healthy. One vocab word that's very important is called the teratogen. Now, a teratogen is any agent that causes an abnormality following fetal exposure during pregnancy. Teratogens are usually discovered after an increased prevalence of a particular birth defect. So a teratogen is any substance that could cause a birth defect, and those substances can cross the placenta from the mother and the fetus and cause abnormalities. So it can cross the placenta and then expose the fetus to that teratogen. The fetus is very vulnerable to the effects of medications during that very first trimester. So even more vulnerable in the first trimester when they're just starting to develop. Before the doctor prescribes any medications, they definitely want to verify the date of the female's last menstrual period. The Learn to Cuss, C-U-S, section in the book on page 28 to 29 is a very good example of this. So a nurse is working in the emergency department and providing care to Anna, a 16-year-old patient. Anna is being treated today for a urinary tract infection, and the physician ordered Cipro, 250 milligrams BID. As the nurse prepares to administer that first dose of the medication, the patient confides in her that she may be pregnant. Her menstrual period is around 2 weeks late. The nurse calls a physician and uses the CUS communication strategy. So C stands for concerned, expressing what you're concerned about. Hello, doctor. I'm concerned about administering this medication to Anna, speaking about the Cipro. U stands for uncomfortable. I am uncomfortable about it because she has confided in me that she may be pregnant. S is safety. Cipro is a category C medication, and we'll talk about that in just a moment, but category C means it's shown to have an adverse effect in pregnancy, so you want to be extremely careful. This is definitely a safety issue. This is a safety issue for the fetus. Can I have an order for a pregnancy test before administering this medication? So this nurse was smart, realized that she needed to assess whether her patient is pregnant in order to determine if this medication is safe for her to give. These are our category system. So the Federal Drug Administration provides pregnancy category system for medication use in pregnancy. Category A is safe. Category A, safe. Excuse my handwriting with this computer. So A is good to go. They've had adequate, well-controlled studies that have shown that there's not an increased risk of fetal abnormalities. So it is safe. Category B medications and animal studies, these medications have revealed no incidence of harm to the fetus. However, there are no adequate and well-controlled studies in pregnant women. They don't have enough information to determine yet. In some animal studies, category B meds have shown an adverse effect, but adequate and well-controlled studies in pregnant women have failed to demonstrate a risk to the fetus. Category C medications. Animal studies have shown an adverse effect here. And there are no adequate and well-controlled studies in pregnant women. So use with caution. Category D. Inadequate, well-controlled studies and an observation in pregnant women, these meds have demonstrated a risk to the fetus. However, the benefits of the therapy may outweigh the risks. Category X, inadequate, well-controlled studies and by observation in animals or pregnant women, these meds have demonstrated a positive evidence of fetal abnormalities. The use of Category X medications is contraindicated in women who are or may become pregnant. You always want to request an order for a serum pregnancy test to ensure the woman is not pregnant before you give a Category X medication. And in that safety stat box on page 34 of your maternity book, it talks about how the woman should also be taught that over-the-counter medications may not be safe in pregnancy. You should not assume that just because the medication is over-the-counter that it is safe and okay to take. She should always check with her healthcare provider before taking any medications, even over-the-counter or herbal medications. Next, we're going to discuss the effects of teratogens on fetal development. This is just an outline. We're going to be talking about each of these teratogens separately on the following slides. The first teratogen we're going to discuss is tobacco. So smoking causes vasoconstriction. It constricts the blood vessels. It leads to a much smaller placenta, And we know the placenta delivers oxygen and nutrients to the baby. So if smoking causes the placenta to be smaller, the baby is not getting as much oxygen and nourishment as normal. So the smaller placenta decreases the nourishment and oxygenation that the fetus is receiving. Therefore, it can lead to a smaller baby with delayed development. Also, babies who are born whose mothers smoke while pregnant and babies who are exposed to secondhand smoke after birth are more likely to die from sudden infant death syndrome than babies who are not exposed to cigarette smoke. Adverse effects of smoking in pregnancy and excessive exposure to secondhand smoke are low birth weight, premature rupture of membranes. So mothers who smoke are more likely to deliver their babies early. Preterm delivery is the leading cause of death, disability, and disease among newborns. Placenta previa, which we will discuss later in this unit, placenta abruption, preterm labor, and ectopic pregnancy. It's advised that you use the 5 As model to address smoking in pregnancy. So ask her about tobacco use, advise her to quit, assess the willingness to quit, assist in the quit attempt, and arrange for a follow-up. So make sure you understand that since tobacco and nicotine causes vasoconstriction, using a nicotine patch is going to have the same problems for the placenta as smoking. The safest way for a pregnant woman to stop smoking is cold turkey. No meds, no nicotine patches, no nicotine gum. Pregnant women should avoid alcohol throughout the pregnancy to prevent lifelong problems for their child. Fetal alcohol syndrome is a condition in a child that results from alcohol exposure during the mother's pregnancy. Fetal alcohol syndrome causes brain damage and growth problems. The problems caused by fetal alcohol syndrome will vary from child to child. However, the defects caused by fetal alcohol syndrome are not reversible. There is no amount of alcohol that's known to be safe to consume during pregnancy. If you drink during pregnancy, you're placing your baby at risk for fetal alcohol syndrome. This can lead to things like small for gestational age at birth, vision or hearing problems, facial abnormalities like a small head, flat face, and narrow eye openings, trouble with concentration and learning in school, and trouble controlling behaviors. It's also known to sometimes cause heart defects and problems with the kidneys and the bones, and problems with the brain and central nervous system like poor coordination and balance, intellectual disability, poor memory, poor attention span and judgment skills, hyperactivity, or rapidly changing moods. It can also lead to problems with social and behavioral issues, like difficulty in school and getting along with others, poor social skills and trouble adapting, difficulty planning and working towards goals. So you can see that it has a lifelong effect. Caffeine. So high use of caffeine has been linked with miscarriage and preterm birth. However, the American College of Obstetricians and Gynecologists Committee states that light to moderate use of caffeine, less than 200 milligrams per day, are not likely to cause miscarriage or preterm birth. So less than 200 milligrams per day. This is a typo, I'm sorry. I will fix that. Less than 200 milligrams per day. The 200 milligrams per day is roughly equal to about 1 12-ounce cup of coffee. Marijuana use during pregnancy can be harmful to your baby's health. The chemicals in marijuana, in particular THC, can pass through the mother's system to their baby and can harm the baby's development. Marijuana use can affect placental development and implantation. Research shows that intrauterine exposure to THC, the chemical responsible for most of marijuana's psychological effects, can affect neurological development of the newborn. Cocaine can cross through the placenta and into the developing baby. It also takes longer for a developing baby or newborn to get cocaine out of their system than it does an adult. Using cocaine during pregnancy can cause serious problems for the baby before and after birth. The problems can include growth retardation and microencephaly, which is a small brain and small head. It's associated with an increased number of placental abruptions. This is a serious condition in which the placenta separates from the wall of the uterus before birth. The placenta supplies the baby with food and oxygen through the umbilical cord, so a placental abruption can cause very heavy bleeding and can be deadly for mother and baby. It can lead to premature birth. Happens if the baby is born too early, before 37 weeks of pregnancy. Low birth weight, neurobehavioral abnormalities after birth, abnormalities with the genitals, kidneys, or brain. It can cause withdrawal symptoms. So, neonatal abstinence syndrome, NAS. This is a group of conditions a newborn can have if its mother is addicted to drugs during pregnancy. So, neonatal abstinence syndrome happens when a baby gets addicted to a drug before birth and then goes through drug withdrawal after birth. Symptoms usually begin shortly after birth and can last several weeks. Symptoms can include tremors and shaking, increased irritability, trouble sleeping, excessive crying, sleeplessness, difficulties with feeding, muscle spasms, and just uncontrollable crying. Heroin in pregnancy and its associated lack of prenatal care have been associated with adverse outcomes in pregnancy. Heroin crosses the placenta and often leads to neonatal addiction. Other effects include increased risk of premature birth, low birth weight, hypoglycemia, low blood sugar, and intracranial hemorrhage in the uterus. It can lead to neonatal abstinence syndrome, like we discussed on the previous slide, where the baby becomes addicted and has withdrawal symptoms, like excessive crying, irritability, tremors, slow weight gain. It can even lead to seizures and death in severe cases. Methamphetamines in pregnancy can be associated with elevation in the heart rate of the mother and the fetus. an increased risk of preterm labor, an increased risk of placental abruption, where the placenta separates from the wall of the uterus before birth, and it can lead to some severe heavy bleeding and can be deadly for mother and baby. So as nurses, we play an important role in providing support and education to our patients during pregnancy. We need to be open and honest with women and their partners as they discuss sensitive lifestyle issues like the use of drugs, alcohol, and how they can cause birth defects. Techniques that encourage communication include the use of non-judgmental, open-ended questions, conveying acceptance, and focusing on patient concerns. These are some environmental toxins that can be dangerous. To prevent exposure to chemicals, cleaning products, or heavy metals, always follow safety guidelines. Avoid exposure to lead. It's very toxic to the brain and nervous system of the fetus. It can be found in toys, costume jewelry, pottery, some folk remedies, lead-based paint. Avoid exposure to mercury. Fish contains a lot of mercury and it should be avoided. Avoiding fish that contain mercury. Mercury affects brain development in the fetus, and fish that contain mercury that are not safe during pregnancy are sea bass, orange roughy, swordfish, and tuna. Avoid foods that harbor listeria. This is a type of bacteria in water and soil. It can be found in uncooked meats, uncooked veggies, unpasteurized milk, and food made from unpasteurized milk. Deli meats have also the potential to be contaminated after cooking and before packaging. Avoid exposure to paint. That's a mix of chemicals that can lead to birth defects and developmental disabilities. So have someone else paint the nursery. Avoid exposure to pesticides used to control weeds, insects, cockroaches. BPA plastic products. The pregnant woman should look for BPA-free plastic products. BPA plastic bottles was shown to have hormone-like effects on the developing reproductive system and neurobehavioral changes in the offspring in animal testing. Hot tubs and saunas, that can lead to maternal hyperthermia and linked with possible central nervous system defects. Avoid contamination with toxoplasma. We'll also talk about this in one of the other chapters in this unit. Toxoplasma or toxoplasmosis is acquired 3 ways: either food contamination, pet to human through feces, and mother to fetus. Pregnant women should avoid eating undercooked pork, lamb, and venison, and should avoid emptying the cat litter box. Toxoplasma can be found in cat feces. Toxoplasmosis is a serious illness that can be transmitted from the mother through the placenta to the fetus, and it can cause blindness and central nervous system for the fetus. Also avoid travel to countries with active Zika virus transmission. That can be linked to fetal anomalies.